Okay.
Okay, so I've validated the doctor's orders. I've organized my supplies for the NG tube. I'm gonna walk into the patient's room. Hello, Mr. Jones. My name is Corey. I'm gonna be your student nurse, okay? Can I get your name and date of birth?
Pat Jones, 11/10/1965.
11/10/1965, Pat Jones. Let me see here. All right. Looks like we are good to go, Mr. Jones. So I'm going to be doing an NG tube on you today, and that is a tube that goes from your nose down to your stomach. And we're going to check out your stomach contents, and we're going to do a tube feeding on you as well. Okay?
Okay.
So I'm going to raise the head of your bed up. Okay, Mr. Jones, I'm going to take a look in your nostrils. Do you have any history of trauma or surgery to your facial bones or anything like that?
No.
No, okay. So this shouldn't cause any problems, right? Have you ever had one of these before?
No.
No? Okay. So can you breathe out of your left nostril?
Mm-hmm.
How about your right?
Mm-hmm.
Okay, very good. I'm gonna use your left nostril. It looks a little more clear. It looks like a little more open, okay?
Okay.
So put this towel on you. Are you allergic to latex?
No.
Not allergic to latex, very good. Okay, so what I'm gonna do is I'm going to measure the NG tube. I'm gonna measure it from the tip of your nose to your ear, and then down to your xiphoid process, excuse me. Let me move this here. Nose, ear, and to your xiphoid process, which is about right here. It's gonna give me about 55. Okay. How's that towel? Is that okay?
That's okay.
Good, thank you. All right, so while we're doing this, I'm gonna have you sip on some water, and that's gonna help lubricate your throat and help this NG tube go down a little more smoothly for you and I, okay?
Okay.
So, I'm gonna lube up the end of this tube, and we'll begin. Okay, start sipping that water. Keep sipping. Okay, keep going, almost done. Almost in. Okay, we are there. Okay, no stomach cramps or nausea or anything like that?
No.
Okay, not too bad. So I'm gonna tape this in place here real quick. Okay. Now, I'm going to verify the placement by pushing some air into that tube and listening to make sure I can hear it in your stomach, okay?
Okay.
So I'm gonna push 15 to 20 milliliters of air into your stomach. Let me take that cup from you. Okay, I hear a whoosh, which verifies a correct placement. Now what I'm going to do is I'm going to aspirate your stomach contents. Okay, so I'm getting some, about 35 milliliters. That's all you got in there. Probably pretty hungry. So now I'm going to check the pH, and the pH looks good. Now I'm going to put this back into your stomach, okay? Okay. Very good. Okay, Mr. Jones, I'm gonna send you down for an x-ray, okay? So, x-ray comes, they verify the placement, I come back in, When I come back in, I perform proper hand hygiene. I don my gloves. Hello, Mr. Jones. The X-ray indeed verified the placement of that NG tube. So we're just going to make sure that that thing stays in place, okay? So I'm going to put another piece of tape over it here, okay?
Okay.
And then what I'm going to do is I'm going to pin it to your shirt here as well. Okay. All right. That way it doesn't go anywhere. We need that to stay where it is, okay? So now we're going to do a tube feeding on you, okay? Are you allergic to any foods? Do you have any food allergies?
No.
No? Okay. So I'm verifying the date of the food, and I verified the patient didn't have any food allergies. I'm going to mark any supplies like this food that I will be reusing later in the future. So what I'm going to do is I'm going to verify gastric sounds again before we start the feeding. So I'm going to blow some more air into your stomach here and make sure it sounds right, okay?
Okay.
Okay, once again, I hear that proper whoosh. It tells me that my placement is correct. And then I'm going to aspirate the contents of your stomach. Okay, so get in some resistance, and it's about 45 cc's, or not cc's, milliliters, excuse me. So I'm going to test the pH, and the pH looks good once again. I'm going to put this back in to your stomach. Okay. Now, so Mr. Jones, you said you don't have any food allergies, is that correct?
Yes.
Okay. So we're going to start with the feeding. So what I'm going to do first is I'm going to flush this NG tube with 50 to 100 milliliters of room temperature to warm water. Okay. There's about 80 milliliters. And now we're going to start the feeding. Okay. You having any nausea, stomach cramps or anything?
No.
No? Okay. So if he was having stomach cramps, I would lower this tube where I'm feeding from so that it would go in a little slower and maybe be less agitating to his stomach. Okay, he has the whole can. Okay, now I'm going to flush with another 50 to 100 milliliters of tap water. That's warm, not hot. Okay, there's your 50 milliliters. Okay, so I'm going to take that off. Plug you up here. Okay, Mr. Jones, I'm going to let you digest and rest, and we got to keep you in this upright position, okay? That way you don't have any digestion problems or anything like that, okay? So what I'm going to do is I'm going to come back in about a half an hour. Here's your call light if you need anything. Give me a buzz. Otherwise, I'll see you in a half an hour, and we're going to DC that NG tube. So I perform hand hygiene. I leave the room. A half an hour goes by. I come back in the room, perform hand hygiene. Hello, Mr. Jones. I'm back. We're gonna discontinue that NG tube, okay?
Okay.
Very good. How you feeling?
Okay.
All right, good. So what I'm gonna do is I'm gonna take all this tape off you. Okay. Now, when I pull this NG tube out, I'm gonna have you take, before I pull it out, I'm gonna have you take a deep breath, okay? And then I'm gonna pull it out while you hold your breath, okay? So, deep breath. Okay, hold it. Here we go. Okay, very good. So on the NG tube, I'm looking to make sure the NG tube is fully intact and there's no blood or any reason to think that this caused any trauma to Mr. Jones. And the end is intact and the rest of it is intact and not occluded in any way. What I'm gonna do is I'm gonna dispose of my supplies in the proper receptacle according to company policy. And then I'm gonna take this towel. Mr. Jones, how are you feeling?
Good.
Good. All right, I'm gonna lower you, okay?
Okay.
You wanna stay sitting up just a little bit and watch your TV?
Yes, please.
Okay, tell me when.
That's good.
That's good? Okay. You're feeling okay?
Mm-hmm.
All right, this is your call light. If you need anything, just push this red button, okay?
Okay.
All right, I'm gonna clip it right there. If you need me, push the button, and bed's locked. The rails are up. Everything looks good to me. All right, I'm gonna go chart.
Raise your hand.
Oh, is that?
Sorry.
Dang it.
I was trying to
Is that
pull you
bold?
so bad.
Is hand washing bowl on the end?
No. No.
It's fine.
Oh, I guess you can cut it what I said about your hand.
Yeah.